as well as our support staff. Marshall, I think we are a quorum, so we can start.
Good morning, Chair. Yes, we are. Good morning, everyone on the platform. Chairperson, would you like me to display the agenda?
Please, Marshall. Honorable members, Honorable MEC, the delegation from the Department of Honorable Adrianza, I see your hand is up.
It's just to move to adopt the agenda, Honourable Chairperson. Good morning.
Good morning. You are in advance, Honorable Adrianza. I just want to welcome the honorable members. Then we will move to the adoption of the agenda. So, to the honorable members, the honorable MEC, delegation from the department, national as well as provincial, as well as our support staff, I want to welcome you to the select committee on this morning. So, we will move now over to the adoption of the apologies. Honorable Adrianza has already moved for the adoption of the agenda. Is there a seconder?
Honorable Subande Seconda.
Thank you, Honorable Sibande. So the agenda is duly adopted. So we will move now over to the apologies. Marshall.
Again, good morning, Chairperson, members, and everyone on the platform. Chairperson, we have received an apology from Ms. Briet. She is on study leave. Thank you, Chair.
Thank you very much, Marshall. Honorable members, there's only one apology. Can we get a move for the adoption of that apology? Honorable Fanny.
Good morning, Honorable Chair. I move for the adoption of the apologies.
Thank you, Honorable Fanny. Honorable Adrianza.
Thank you, Honourable Chairperson. I move to second the adoption of the apologies.
Thank you very much, Honorable Adrianza. So the apology is duly adopted. So we will move now over to the next agenda point. It's the follow-up briefing with the Gauteng Department of Health on undertakings following the oversight visits. Honorable members, it's more than a year that we visited the Department of Health in Gauteng, and there was some recommendation that this committee have made. I just want to indicate to the department I'm very disappointed, Honorable MEC. We only received the presentation this morning, and for a year that have passed to only give us the presentation this morning, it's not acceptable. We really can't, it's like undermining this committee because we have waited, so it will be a struggle to get into the presentation because we only have received it this morning. But without wasting any time, Honorable
That's the Afrikaner.
Honorable Mampuru, can you please mute? You are interrupting the meeting. So, Honorable MEC, I will give over to you. You will have, as a department, you will have 30 minutes to present. Thank you very much. Honorable MEC, over to you.
Yes, thank you very much, Chair. I hope I'm audible. I'm not in I have network challenges. I'm working in the rural parts of Gauteng. And let me appreciate this opportunity to be able to present. And as like the chairperson is indicating, it's a follow-up on what will have been requested from the department. Paul, I'm with the acting HOD and also with the TTG for infrastructure. Let me hand over to the acting HOD, Darion, please. Dr. Parel?
Thank you, MEC. I will just request the presenters to just open their videos for a few seconds so that we as a committee can see you, and then you can put it off again. Thank you very much, MEC. Over to you, Acting DG.
I'm sure you can see my face.
Good
Thank
morning.
you.
Good morning, Honorable Chair. Good morning to the honorable members. Chairperson, let me profusely apologize from the onset. We shared the presentation yesterday, but we did realize there were some technical challenges. But that's not your fault, Chair. It's our fault. Our sincere apologies for that. Chairperson, the presentation that we will be tabling will specifically focus on the visits that has been undertaken by the select committee across the health facilities, that's clinics and health centers in the city of Joburg, city of Tshwane, and then also the city of Ekurhuleni. And we will provide you a report on each of those institutions that you have visited, Chair. Chair, let me also state up front, you will notice that the presentation that we will be tabling will demonstrate some progress that we have made in a number of areas relating to infrastructure and other operational improvements. But Chair, as a department, we note that with the current challenges in the fiscus, we have not fully realized all the infrastructure deliverables that we wanted to, but there are also plans to ensure that we institutionalize some of those changes in our operations. And with our aging infrastructure, Chair, it just makes it very difficult to fully comply with each of the preventative maintenance programs that we are running. But we must say, Chair, we have brought our facilities up to a state where it is habitable, but it requires still a lot of work. Chair, I can say I am in the meeting with the head of the performance monitoring and strategic planning team, Mr. Ngwepe, that is here. He's going to lead us on the presentation. I'm also supported in the meeting by the DDG responsible for infrastructure, Mr. Galada, and the team. So, Chair, if you will allow, Mr. Ngwepe, you can load the presentation, but also lead us on the progress. Thank you very much, Chair.
Okay, thank you so much, and Honorable Chair, good morning. I'm trying to see if I can just put my video for a second. So I see there's a glare at the back. That is myself, and thank you so much for the platform. Let me greet you once more, Honorable Chair and the committee members, as well as the MEC, the HOD, and the senior managers on the call. So I'm just going to touch base with regards to progress that has been made ever since your visit to our institutions. Of course, just as a recollection that this committee did conduct an oversight visit from the 24th to the 28th of February, that is sometime early last year. And then this particular visit actually focused on just trying to assess the status of our infrastructure, as well as medical equipment and some service delivery challenges that were there at the time. Of course, the committee has quite visited hospitals, CHCs, and some clinics that we have in various districts. And of course, based on that particular visit, the committee did provide the department with a report, detailed report that had recommendations that they requested the department to implement in as far as those particular recommendations are concerned. So the purpose of this presentation, of course, is to provide the committee with those particular recommendations, and the progress in as far as the implementation of those recommendations are concerned, and definitely, just to ensure that we strengthen accountability as the committee serves in an accountability structure, to government processes. So I'll start with the first hospital. Of course, this was the Tambo Memorial Hospital. And the committee did observe that this is the very same regional hospital that was affected by the a gas tanker explosion some time back towards the Christmas at the time, which affected the infrastructure, that was, at the particular facility at the time. So what the committee then recommended was to look into the budgets of the particular hospital, look into the maintenance budgets, look at some of the work that has been done, and they recommended that we provide a detailed breakdown of that particular budget. So what you're seeing on these slides, including some of the accruals and the revenues that we are able to collect as a hospital. So what you're seeing on the slides just speaks to the budget that is allocated to the facility. Of course, as you can see, that during the 2025-2026, the facility was allocated, 1.2 billion rand. And as you can see, the voted funds account for the majority of the particular, appropriation to the facility. As of the end of the financial year, of course, which ended in March, you will see that at the bottom that we had overspent, and we are sitting at an over expenditure of 103.6%. That is with regards to certain areas where we've overspent. And if you look at those voted funds, you will see there's a bit of over expenditure with regards to the compensation of employees. You will see that there's also a bit of expenditure on the training, component by 110%. Chair, there's also the committee also requested us to provide the status of our accruals. And as you can see, as of the end of March, and of course, I'll touch into detail on this one as I go with regards to what is the composition of that particular, amount. So the facility was sitting at 72 million of accruals as we closed that particular financial year. And of course, what you're looking at in terms of the positivity is that the facility did manage to collect its revenue. As you can see, it was given a target of 18 million, but the facility 18.3 million, but the facility managed to collect for the financial year 18.9, almost 19 million. This is from patient fees mainly. In the next slide, then we looked at the budget allocated to the infrastructure, but this time around we look at this particular financial year that we just started now in April. And just to provide a breakdown to say that for maintenance, the facility is allocated a budget of 2 million, just to ensure that they assist with regards to minor maintenances in the particular facility. And to date, in the past 3 months, we have spent 6.7% of that particular budget appropriation. The committee is expressed to say they need a breakdown in terms of the accruals at this particular institution. And what we then provided is the accrual of 72.3 million. And this is the breakdown in terms of the payment proposals, sitting at the majority of that 95%, as well as those GRVs that with no invoice that are sitting at 3 million. So this is the status as far as the budget amounts are concerned at Tambo Memorial Hospital. In terms of the Tembisa Hospital, of course, the facility did, the committee did specify that we are still using a paper-based system in terms of that. And of course, the institution is not yet a fully fledged tertiary institution, but of course, it delivers most of those particular services. And also the condition in terms of the infrastructure of the facility needs to be looked into in as far as this is concerned, just to ensure that it supports. And given that is also one of the facility that contributes, that accepts a lot of deliveries and that produces a lot of deliveries on a annual basis. There were also recommendations from the committee that we must look into establishing a breathing unit at a district level, just to assist in terms of decongesting the facility itself. So I'll just go into each of the recommendations that we have here. Of course, one of the things that was mentioned by the committee was how do we ensure that this particular facility is compliant? And by compliant, of course, they're looking at certain things, your synergies, fire safety, equipment, and maintenance. And of course, just to also highlight to the committee that we actually appointed a contractor, for a period of 12 months. Just to look specifically into the compliance matters. That is basically making sure that there's sufficient synergies, there's sufficient fire safety, the adequate equipment are there in place. In terms of appointing an additional contractor for long-term maintenance, of course, we do have a panel of contractors that are actually allocated just to ensure that this panel of contractors maintains our facilities, and they do ensure that whatever is happening in facilities in terms of minor, maintenance that needs to happen, be it your paintings, breakages in the facilities, they attend to those particular, maintenance requirements. So what has happened is that once we finalize with those particular panels and we are done with those particular processes, we'll have a dedicated, a contractor at the facility just to ensure that they do provide those kind of services in the facility. Of course, there were also recommendations with regards to the storage consents, and of course, the committee did recommend that we actually address the storage issues. This is not in the current, budget financial year for the financial year, but of course, we want to include this in the next, financial year, that this project can commence during the 2027 and 2028 financial year. What the committee also, recommended is to establish a functional midwife bathing unit at a district level, and this is because the facility is usually, congested, is usually, receiving a large number of individuals in as much as maternity services are concerned. So what we have now done is that, of course, we've built a mother and child lodger that takes about 15 people at the institution. What we need is adequate funding that we are busy engaging with Treasury to assist us with regards to doing that, so that we can also have a bathing unit that actually supports this particular facility. On the next slide, Chair, what the committee also recommended was the issues with regards to the manual processes in the pharmacy units, and this resulting in the queues that we have, as well as the manual, in terms of the manual documentation that we are using in the facility. So what we have then decided to now look into is to undertake, so we're implementing a queue management system across our various facilities. This includes, your Charlotte Mateke, Dr. George Mokari, Rahima Musa, where actually the individuals that come into the facilities, they're given a particular ticket and then they queue, and then they're able to be managed like that, just to assist in terms of managing those particular queues. So we actually have, Tembisa Hospital as part of the upcoming hospitals that we are targeting. So for this particular financial year, we're targeting an additional of 12 hospitals that are going to be on queue management system, and just to assist with regards to the queues, especially in the pharmacy units, but also just to talk about the storage, and the dispensing challenges. The National Department of Health is assisting us with regards to an electronic system, and this is what they want to implement throughout the various provinces. This is a pharmacy system that will be used to manage, the prescriptions and the dispensing of medication, just to keep track in terms of what we manage to dispense and what we manage to also track. Of course, what the committee also observed is that there is no district or regional hospital supporting this tertiary hospital within the Tembisa area. And of course, and this results in the issues that we have currently, where you've got CHCs that are referring directly to Tembisa. And this, of course, results in the issues that I specified regarding, a congestion and all the other issues. But what we have also done is we have strengthened the referral process. So late last year, we have now a referral policy that kinds of assist in terms of ensuring that the referral routes are established between, the different districts. That is assisting in terms of knowing that the different facilities will now refer to the nearby district and the nearby regional hospital, as opposed to going directly, to the Tembisa, just to assist in terms of ensuring that that particular hospital remains stable and is decongested. The next facility, of course, this is the Rahima Musa Hospital. And then Rahima Musa Hospital, one of the issues, these were mainly infrastructure related issues. And the issues that were the recommendations from the committee was we really need to ensure that we repair and replace those sewer lines in the outpatient and the pharmacy buildings. And of course, this, I'm pleased to actually inform the committee that, of course, this issue has been attended to. We appointed a contractor and just to ensure that they deal with this particular issue. So this is one issue that we have managed to address at the facility. Of course, there were also major service issues that the committee has picked up and has addressed that we, of course, have got best pipes and outdated systems that we need to look into. So, of course, we have a major refurbishment project that is undertaken at Rahima. And of course, the contractor there is the DBSA that is assisting with regards to that. Part of those particular major refurbishment is to look into some of these issues that the committee has also also specified with regards to the major service and best pipes. So these are going to be addressed within this particular 2026-2027 financial year. With regards to uninterrupted power, of course, what we have now done, because the power is provided by the city power. So what we have now done is we have done a feasibility assessment just to estimate in terms of how much will it cost, just to ensure that, and this is not only at Rahima, it's also at other facilities, just to ensure that we take some of our facilities off, to be non-dependent on the grid. That is to have an optional power supply that will kick in a case where we have got power cuts for whatever reason that may be. So of course we're busy with that particular feasibility study just to see how much it would cost just to install the solar panels just to support that facility in terms of the power supply. The next one that the committee has recommended was with regards to air conditioning. Of course, and this is part of in the scope of this particular refurbishment project to be carried out in the financial year by the DBSA. Of course, the other recommendations from the committee looked into the issues with regards to the pumps at the facility, and I'm pleased to actually mention that we have done this late last year, and this has been concluded. The other issues on refurbishment and ensuring that the facility is compliant with the OHSC standard, this is also part of the scope that will be taken care of within this particular financial year, by the contractor DBSA. But what they also specified is that the committee specified is that the CCTV system that we have does not cover all areas of the hospitals. So what has been requested is we must look into how can we add additional CCTV onto this. And this is the project that our ICT teams are planning to implement within this particular financial year. You would remember that we have a command center that is based at Chris Bara, where all these link facilities actually you can be able, they actually connected the particular command center. So this is a project that we are going to be undertaking in the current financial year. Chair, the next one looked into the Davidton Main CHC. Around the Ekurhuleni area. And I'll just go into this quickly. So in terms of what has been, requested or recommended by the committee. So the committee has observed that the facility is quite old and it definitely needs some bit of refurbishment. It operates on a 24-hour basis, which means that the emergency area where we are needs to be refurbished, which of which we do state that, of course, we have undertaken the activities. This emergency area has been refurbished, and we now have a new, refurbished emergency area, as well as the holding area. As this is a 24-hour facility, as well as the holding area, just to ensure that we actually are prepared for those emergencies that occur after hours. Of course, the committee also addressed concerns with regards to the filing space. And if you would, the committee would remember that some of the files, of course, they were on the floor, and they had then recommended that we look into, modifying the filing room and making sure that we organize a particular space just to ensure there's enough, filing within that particular space. So, of course, this is a project that we have done. We've completed this particular project. And of course, when I go into the next slide, I'll just show in terms of some of the renovations that we have done in the facility. Of course, there were concerns of the clinic committee that we have requested. And I'm pleased to actually mention that the issues were quite addressed. But the one issue that is still pending and which is resulting in the resignation of most of our clinic committee members is the issue of the stipend, where the committee members are really requesting that the department do look into, finding alternative funding just to pay the stipends to those particular clinic committees. And this results in very low participation in terms of our clinic committee members. Of course, the MEC, after being appointed, he did go on to district by district just to, hear some of the issues or the concerns of the clinic committee members and understand with regards to what needs to be implemented. So, of course, we're looking into those areas, including the areas of seeing where we can find enough funding just to ensure we support their stipends where applicable, so that we can have stability in terms of governance of our clinics. So that is the one area that we are also strengthening. Chair, if you look at this, we just took some pictures of the facility itself after the refurbishment. Of course, this looks way much different as compared to how the committee looked at it, observed while they were there. This is our emergency room at Davidton Main Clinic. And as you can see, we now have, dedicated beds with the separators. And then this is our holding room. Of course, in the particular facility, we now have air conditioning, and then of course new tiles, and we actually do have the facility painted, and then this of course is our new filing cabinets that are now installed in the facility just to ensure that our files, our paper records are up to standard and they can be easily accessed and retrieved, so that the patient doesn't take time while waiting, and we're looking for those particular files within the filing room. So that is as much as the Davidton CHC is concerned. But there's also, in terms of the facilities, the committee also visited the Dilope clinic. This is in the city of Tshwane. And what they then observed is that we had issues with regards to, and this was actually a clinic that we got, a land that we got from an existing structure, which was initially at a particular house, and that house was rezoned just to serve as this particular facility, just to support this particular facility. So what the community has observed is that we needed to actually ensure that we procure sufficient chairs, just for clinicians as well as patients, as some of them were sitting outside and some of them were not having sufficient chairs. And just to specify that we are in the process of finalizing that particular procurement, need assessment has been done, and 45 patient chairs and 20 staff chairs are approved for procurement. So those procurement processes are underway just to ensure that we procure those particular chairs as well as for staff and for our patients. And then, of course, what has also been requested was that the issue of filing. We need to ensure that we get the filing cabinets, just to ensure that we install them in the facility, and the facility does have proper cabinets just to store our files. So what we have done is that we have done the inventory assessment with regards to this, and then this is also lined up to be procured in the current financial year. The other issue that has also been raised is the issue from the staff members themselves, when they did mention with regards to their inability, to be able to contact or trace patients, as they did not have mobile phones at the time. And also just to assist in terms of implementing an electronic filing system, just to assist in terms of having, electronic paper records. So happy to say that, of course, the department has went on to, recruiting what we call, teletracers. So teletracers are individuals that are responsible using their mobile phones, be able to teletrace patients that are lost to care, or just remind patients to return back to care. So that is at a district level. And this is through our HIV and TB, grant, just to ensure that they support those activities where patients are able to be called and they're able to be reminded of their visits and to come back to the facility. So that is one thing that we have also implemented to support that particular facility. With regards to the electronic filing system, so the facility is currently using what we call the HPRS. So the HPRS is the Health Patients Registration System. There's a nationwide platform that is being rolled out, by the National Department of Health in all the facilities, just to ensure that one patient can have what we call an HPRN, Health Patient Registration Number, which that number can be used when a patient travels. Let's say maybe a patient moves from one clinic, or one province to another province still within South Africa. That particular number will then be used to know that indeed this patient has received services in a particular facility, and this is what their medical record looks like. So the HPRN, what has been implemented is now the demographic and registration, system that focuses mainly on identifying who you are, giving you a file number so that you can actually be able to identify the particular patient. And what we're now undertaking together with National is what we call the EMR, which is the electronic medical record. And of course, the National Department of Health came to Gauteng just to do a pilot of that system. So it will now be a clinical record that will be implemented in our clinics just to ensure that after the patient is registered on this HPRS and they go into consulting room, then they will now continue using that EMR, which will now assist in terms of that particular consultation and the electronic file. The committee also recommended that we look into having a new clinic a structure that complies with the ideal clinic status. Of course, we have done a clinical brief that we have sent as a requirement for us, to ensure that the clinic does, comply with the required ideal clinic standards. And of course, that has been approved now by the National Department of Health. We just, in terms of implementation, are waiting appropriation in terms of the budgetary availability, just to ensure that, we now commence with, the construction as much as that particular process is concerned. Of course, the committee also, specified that we must give, in terms of some of the projects that we are undertaking, specifically at Jubilee as well as Tambo Memorial. As I've mentioned, some of the hospitals that the committee has observed, and they were in a very dilapidated state. So this is just a breakdown of what currently we have been doing. So in terms of Jubilee hospitals, of course, we have focused more on just ensuring that we bring our kitchen into proper status, and that particular project has been concluded. But some of the maintenance processes are still underway. This includes our boilers, being able to repair those and service those, our mortuary cold rooms, water tanks. And as you know, water is becoming really a very scarce resource, especially in Gauteng. So that is also some of the projects that we put underway just to ensure that we've got an alternative source of water. Looking into some of the broken windows as well as theatre refurbishments that we are looking into, and as well as some of the facelifting in the facility, just to ensure that the facility looks way much better. These are the projects that we are currently busy with in this particular financial year. So looking at Tambo Memorial, we are doing quite a lot of the repairs there. Also, given that particular explosion that happened some time back, that gas tanker did affect the structure of the facility. So if you look at the mechanical, this is what we're actually focusing on in terms of just trying to bring the facility back to its glory in terms of what it should be looking like. Of course, some of these particular projects are completed and some are still underway. And in terms of the electrical components, of course, those elevators and generators, those we're currently focusing on, as well as ensuring that we are actually doing the refurbishments on the brick and mortar and on the building. And this is what we actually looked into in terms of just ensuring that, some renovations in the various wards, as well as ensuring that the paintings are good and those windows and doors are actually, refurbished. So, of course, the committee did mention, recommend or request that as the department, we must look into some of the general item and some of those areas where, in overall, we must look into improving the turnaround time, in as much as addressing infrastructure requests is concerned. So, of course, we have now redefined that particular process, and we now have to respond within 3 days to whatever issue that has been raised. So our turnaround time for infrastructure requests across all facilities is now 3 days. So in terms of providing report to relevant stakeholders, we've got quite variety of meetings that we have. This is at a hospital level, the district level, management level, and of course, our principal and executive authority. The MEC does, do surprise and organized visit to institutions just to ensure that, she assesses progress and she also monitors, some of these challenges that are there in the particular institutions. So, of course, what the committee has also picked up is the issue of the human resources. And by the time that the committee visited, that we still had a moratorium on posts, which the committee also quoted in the report to say that we need to actually look into what would be the plan then after that uplifting of the moratorium just to fill all the posts. I'm happy to say that ever since then we have actually went on a very comprehensive recruitment drive. Of course, we've got those statutory positions that are mandated that we should be able to fill out as part of the requirements for training and also exposure of clinicians. And this includes our registrars, community service medical officers. Those positions have been filled in various institutions. We can provide a committee with a comprehensive report per institution that says ever since the visit what has been filled, what has vacant and what has been filled to date. We've also filled critical posts such as our nurses. We had a central advert where we advertised for 500 nurses, and then of course those have been placed in various institutions ever since this particular visit. We've also field pharmacists. We also made sure that our head of clinical units and our head of clinical departments are also, posts are filled in just to ensure that the critical elements, which is what we do as providing clinical service, is strengthened enough just to ensure that we support that. Of course, Chair, the committee has also recommended is the actings in the facilities in the hospital that they visited, just to say that the hospital managers or the facility managers of the 2 hospitals that they visited were on acting basis, by then. Happy to say, Chair, that we have actually converted now the posts that we initially had. These were five-year fixed-term contracts for CEOs of hospitals. We have now made this particular post permanent, just to ensure that we create stability and also just to ensure we attract various elements, including women, just to partake in terms of competing for those particular positions as a priority, just to ensure there's equity in terms of gender in senior management within the particular in the particular department. So we have actually advertised these positions on our website as well as on newspapers, just to ensure we attract even a larger community. So all of those CEO positions are now permanent, and of course they are advertised, and then they should be closing in early July, and then the recruitment process will be undertaken just to ensure the stability within those particular institutions. Chair, of course, definitely the recommendations is for the committee just to note with regards to the progress that has been made based on the recommendations that they have, sent to the department from their visits, and also just to highlight, Chair, that of course we will continue and providing progress with regards to some of these projects that are underway, especially those that are still in progress on a quarterly basis. And of course, we want to commence as of the end of June, just for the MEC to be able to provide that particular reference and quarterly progress reports in as much as there's consent. Once more, thank you so much.
Thank you very much to the presenters, the acting DG as well as the MEC. We appreciate the follow-up report from the Department of Health in Gauteng. Honorable members, Any questions of clarity or comments? Honorable Du Plessis, Honorable Adriaanse. We will start with Honorable Du Plessis. You may proceed, Honorable Du Plessis.
Thank you, Chair. Just very quickly, the video. There are only three questions, and I think some of it was asked on the ground, but it's just for clarity. With regards to the accruals, it is incredible concern that the accruals are so high in Gauteng. But I'm still struggling to figure out how the accruals happened. So if the department can give us clarity on how the accruals happened, and what will be done to ensure that they will not happen again. So I appreciate the breakdown, but just practical steps on that. Then with regards to the queuing system in Tembisa, what is the cost or the budgeted cost for it, and is there money, and what is the timeline? And then the CCTV program at Rahima Musa, I just want to find out what was previously spent on the CCTV and why did it not cover all parts of the hospital? Thank you, Chair.
Thank you, Honorable Du Plessis. Honorable Adriaanse.
Thank you, Honorable Chairperson. A quick video from me. And before I ask my questions, here we go. First of all, let me acknowledge the presentation, although we received it very late, as you alluded to that, and it made it difficult for us to really study it. But my punchline in this is the fact that we see throughout the report planned, under consideration, feasibility studies, awaiting funding, and plans for the future financial years. And this is still after more than a year since our oversight visit. So I am quite concerned about that, because I know that if you fail to plan, you plan to fail, but how long are you going to plan in this? And how does the department measure their success? By their plans and the feasibility studies, or by the promises that has been put in place and plans deferred? So a project that is completed and that's ready, as we saw with the filing cabinets that has been put in place, that is something you can measure. Now, what tangible improvements can a patient walking into all of these facilities today actually experience that they could not experience when we were there on our visit in February in 2025? Because as we see it, these projects delayed beyond the schedule, these projects over budget, these facilities with critical maintenance backlogs. What's the difference on the table for the patient today, more than a year later? Thank you, Honourable Chairperson.
Thank you, Honorable Adriaanse. Honorable Sibande.
Hey, okay, thank you, Chairperson. But first of all, I wanted to comment something before I start to ask question. But today I'll be just very, very, very low. I won't be so hard. Chairperson, I'm a little bit concerned about number one, the issue that they submitted this report yesterday. I think in future it will be hard maybe to accept to continue with such meeting. But nevertheless, I know very well the MEC, coincidentally, I've worked with her, is a hard worker. I believe that the problem is not, I'm not protecting anybody, but the problem is not with her. The problem is with some of the leadership within the department. That must be corrected with the immediate effect, because it's not nice that when we submit a report and then we reject it, we return it back because we didn't get an ample time to deal about it. And then I'll start with some questions then. Chairperson, I wanted you to start with the issue of vacancies. As one of the honorable members alluded to, issue of that year, our visit was very, very, 2025, that year. It's very disturbing to find that some of these are not yet been filled, because some of these are the contributing of the factors. If we are running short about the staff. And then also, Chairperson, to be straight to the point, I wanted you to go to, if they can open, yes, the screen notice showed now. That in a Dilope clinic, it's very worrisome. When you compare it with the other hospitals or the other clinics, no, everything it's showing that there is a progress, something is happening. But with this one, the only completed one out of how many? 1, 2, 3, 4, 5, 6, 7. Out of 7, only one which was completed. Some of the things which we have indicated that they must be attended to. To me, it's very disturbing. The issue of to say that the procurement is planned for 2026, 2027, is hot hair. Because they should have put it last year. It's supposed to be 25, 26, not 26, 27. It shows that some people, somehow, a person who is responsible in terms of proper monitoring, he or she didn't do his job, didn't make a follow-up in that regard. They only collected the information now to prepare for this meeting. But in reality, nothing was happening. Nothing happened. That is the Jubilee Hospital. It exposes exactly about what is my concern. And then the issue of the local clinic, the new filing cabinets, which I was maybe I wanted to allude to, the issue of 2026, 27. You see, Chairperson, I don't know how to put it, but some people, some learned people within the department, they will assist me. As we looking for this geopolitics, and also which is attaching us in terms of the illegal immigrants, that's where the problem is starting. Whereby when the files are so loose, where people are having an access. That's why we are very concerned about the filing system, that they must be done as a matter of urgent, and it must be protected, because some of the people, if they can have a chance to pick up some of these files, were in danger. You see, these are some of the things which is worrying me. You see, and leaving let me go to another one which is concerning me, Chairperson. The issue of were raised before, some of the issues which were raised before. I spoke about the Jubilee, which is not, non-starter. The issue of what is it? In the general, some of the issues which were raised by the NCOP general. Among of those things, one of our recommendation was that to develop a human resources plan for health that outlines when vacant position will be filled and how the issue of acting facility managers will be resolved. Some of these things, okay, they've indicated something about the progress that have happened, that didn't happen. Myself, my question then will be, for how long does it take to attend some of the things? I know that some of the things are categorized into two. There are things which need long term. There are things which need short term. Because I can't accept some of the things which need short term to be taken and processed in the long term. For how long does it take? I'll put an example. If you recall very well, in some of the areas we were raising also the issue of medication. MEC, in some of the areas, we were raising the issue of, we even put the categories that we were able to classify some of the medication. You see, some they fell with category class 5, 5 and 6, and etc. Whereby some of this medication, it is a must that they must be very closer to the people, that in case of an emergency, the hospital can be able to respond in some of the challenges. And in their response, I think it's quiet about it. They didn't mention some of the things because we were addressing the issue of the pharmaceutical inside the hospitals, that they must be equipped. Pharmaceutical in the hospital must be equipped, all of them. So, Chairperson, and lastly, it's about the issue of Tembisa Hospital. I'll request that they put the slide of Tembisa Hospital, if possible, Chairperson. If possible, they must put the slide of Tembisa Hospital. Tembisa Hospital, that's where there was a serious problem, and the Tembisa Hospital, it was there, national and international, whereby some of the atrocities that took place. With Tembisa Hospital, Chairperson, we have made some of recommendations as NCOP, but some of them, they've, like they just imagine, like this thing of the project will commence in 2027, 2020 financial year. I'm worried about those things now, because there were huge of millions and billions of monies which disappeared, and some of the people were, it was alleged, I will take it as alleged, but why it is practical. Some of people were injured, killed in those crossfire, some of these problems. We didn't just take a visit to Tembisa Hospital. There was a call that we must make a follow-up to check what was happening in the Tembisa Hospital. So I propose that some of your response to be reviewed in order to address some of the problems which were identified in those particular hospitals, in particular in the Tembisa Hospital. The reason is why Chairperson, Tembisa Hospital is among of the big hospital, not exactly like Chris Hani Parakwana, but in the townships, it's among of the biggest hospitals. Some of the things they need immediately to be addressed, to be fast-tracked. Thank you, Chairperson.
Thank you very much, Honorable Sibande. Honorable Makwele, over to you.
Thank you. Maybe let me show my video, and then I'll switch it off through your permission, Chair. Thanks very much, Chair, for affording me the opportunity. Honorable members, the Department of Education from Gauteng Province and the team. Chairperson, maybe let me join my colleagues by welcoming the presentation from Gauteng. even though like others indicated that we went through it, but it also came late. And also to note the progress so far with the issues that we have raised. In fact, Honorable Sibanda has also raised another touching issue about Tembisa Hospital, which we all know that the hospital like Christiani Baragwanath Hospital, those are the hospital that are not necessarily taken care of. But with Tembisa Hospital, as a state committee, we're very much disappointed regarding the issue that is all well known throughout, not only in the country, in the world, about the disgusting thing, Chair, that happened in the department, that when we visit, we thought that is a disease exemplary. But when they were giving us the report, if maybe they remember, we also visited another clinic there at Hamaskral. Is one of the clinic that is in the bit deep rural area of Gauteng, which we found that there were problem of medication. I remember, Chair, if my memory is still serving well, we were in one hospital. I don't know, it is around town. When we were in that hospital, Chairperson, we found that there were a lot of grannies there. I even laughed at when the MEC was telling us the reason why they come there. They come there because they want to see their friends, but only to find that we know at the rural clinics where they're supposed to get medicine, there are no medicine. So I also want to get the clarity as because I never saw any response when they present about the issue of the medicine at that particular clinic. Is it the Lopet clinic at Hamaskran? Maybe they will just clarify me. I remember we visited another clinic there at Hamaskran where they complain about the medicine. But other than that, maybe Chair, as concerned members of the state committee, that we also received this response very late, which I should think maybe through you, I'll suggest that when we have our own meeting, we still need to get maybe to check. I know that we have permanent delegates in Gauteng, those that they can also, when we are satisfied about whether we have produced that report properly, they are able to tell us that all the responses that they said they've done, that is what they've done. Because really, like we have indicated, that if things are not proper, especially at the clinic level, we only camouflage those that are right in town and everything. We are not solving out the problem of health issue in South Africa. We know, the Chair, that when we're in Switzerland, like now as the country, we wanted to see what we call universal health coverage. If we want to see that, if we want to make sure that all people, irrespective of their background, they get equal health care, we need to focus where at the rural area where it matters most. I know that Gauteng, unlike other provinces, they don't have those many rural villages. But if they can't make sure that with this big economy of Gauteng as the city as the big city in the country, they invest so that those areas, those are seen being disadvantaged, they can only benefit. I don't think that we'll realize our goal ourselves as the country to make sure that everyone, irrespective of the background, is getting that. But maybe, Chair, I've been covered by Honorable Sibanda on some many issues, but I'll just pause here so that I can allow. But specifically, I want to check the issue of that clinic at Hammanskraal. Thank you.
Thank you, Honorable Makwele. Is there any other member that wants another bite? If not, I will proceed then. Honorable MEC, in terms of the accruals and the budget, they indicated that they budgeted 2 million for a minor maintenance. So I just want to check with the department, is this budget for the 375 clinics and 37 hospitals? Do we think it's enough for that amount of clinics and hospitals? And in terms of the accruals at 31st of March, I see that there's a 3.4 million amount, and the reason for it, they indicated that there were no invoices. So what is the plan of the department to lower this or to eliminate these accruals in terms of no invoices? And then in terms of the Tembisa Hospital, they only indicated that in terms of compliance, term contractor appointed for a period of 12 months. I just want to hear from the department the starting date of these contractors as well as the completion date for these projects. And then in terms of the Rahima Musa Hospital, it's the same again. When were the contractor When was the contractor appointed and what is the completion date? And in terms of the phase 1 refurbishment project, what is the starting and completion dates? As well as the procurement of the extra CCTV cameras, the dates of procuring this extra CC cameras. In terms of the Davidton main CHC, the procurement of the equipment and beds of the emergency room. The department did indicate that they did procure the filing cabinets, and at Delopi Clinic, also the procurement dates of the chairs, because it's not that much, according to me. And I just want to get info in terms of the tablets for the staff at that clinic. How many is it? Because they indicated that the tablets is still in a working condition. So that is all from my side. Honorable MEC, over to you and the team for the responses.
Thank you very much, Honorable Chairperson, and to the honorable members for those comments and the questions. I will just ask HOD to respond, because he may be knowing how far is the procurement on some of those items. But on the issue of accruals, honorable members, it's a serious problem in the department. Some of these accruals are even 5 years old, if not more. The challenge of sometimes contracting people without POs is one of those problems that I've discovered as I've been engaging with service providers. I've been on a campaign and in Imbizo with all service providers that are being owed by the department. And some of them you discover it is debts that are 5 years old or more. We even owe the National Health Laboratories a large sum of money. My apology. It's part and parcel of trying to pay some of those debts and clean our system and be able to focus and be able to pay people within 30 days. But I'll hand over to the HOD to respond to some of the questions that members did ask. Over to yourself, HOD.
Thank you very much, MEC, and thank you very much to all the honorable members for the questions and comments. Honorable members and MEC, I just wanted to firstly state that when the visit took place in February, at that point in time, the budget was already finalized. So it did not mean that we have not taken the directives and the recommendations of the committee seriously. But what we had to do is we had to identify some savings in some of our projects where we do things more efficiently, because we're on a drive to also make sure that there's value for money, we do things more effectively. And we also hold some of these contractors accountable. And with that said, Chair, we then had to identify where some of the areas identified by the select committee did not have funding. We then had to identify funding throughout and then ensure that some of these maintenance are taking place. Chair, you know, when it comes to multi-year projects, and this is often where the challenge lies. You have a project that's running for about 2 years or even beyond. You commit funding for 1 year. If you do not have funding in the next year, it means that project is coming to a standstill. So I think from a planning side, from us, our engagement with the provincial treasury to ensure that our multi-year projects do get proper funding over the term of the agreement is something that we need to strengthen. Because if you do not have funding beyond 1 year, it means the work that you have done so far, you will have theft of equipment, you will have vandalism, and in the end, the project costs you then double. So as a department, we are strengthening that sort of engagements. Chair, we believe that our patients can comfortably say that there are improvement across all our facilities. Although we cannot say that our facilities have now reached a level of maturity where we do proper preventative maintenance, we do proper maintenance. And here you find ourselves in a situation that we have budgeted for a particular facility. But if we have an emergency in another facility, particularly emergencies when it comes to your HVAC systems, automatically that has an impact on operating hours, theater functioning. You need to then attend on an emergency from there. And you will then have to find funds to deal with that. And that also just have a bearing on the infrastructure, the aging facilities, and you're just spending more and more. So it's also some of the areas that do hamper our ability to be effective. Chair, we also feel that as government, you're not going to have sufficient money over the next 5 years to run the health facilities. And we know that we have not been funded appropriately looking at the number of patients that visits our facilities. So some of our facilities that needs to be rebuilt, where we have land, issues of commercialization is some of the focus areas we are looking at. Also getting our Gauteng infrastructure financing agency involved. But we believe, Chair, the dependencies with contractors, particularly when contractors have cash flow challenges, that is exactly where some of our challenges start. We know that proper contract management forms a key part of project management. And it's also an area that the current team, how the infrastructure team has been ring fenced and capacitated, that there is a clear focus on project management, but then also project contract management. Chair, the one thing that we have said with our medicine availability, and I'm just going to talk in general, our assessment have proven that we always have over 90% availability of medicines. But there are some of those medicines, Chair, that it's the entire country that do not have that medicines. And we have reached an agreement with National that they need to communicate that from a national perspective, that these categories of medicines are now out of stock, and this is the measures that we are putting in place. Because if we only see that in Gauteng, it looks like Gauteng have not planned properly, but then in the end, it is a national crisis. But it's also some of the views that we are taking on very clearly and see how we can improve that. Chair, as MEC indicated, our accruals, Chair, partly is historic accruals. Partly our accruals is also as part of some of the emergency work that we needed to do. And that is where your money really goes to, where there is emergencies, because as soon as you have an emergency, an entire area in a hospital can come to a standstill. And we need to avoid that, because it will have an impact on the patients, it will have an impact on the people that our medical officers see on a daily basis. Chair, the CFO is on the call, the DDG infrastructure is on the call. I'm going to allow them to talk a little bit about some of the details on the details of the contractors, the start and end dates, but also some of our funding issues and what the budgets were based on the requests that you have made. But we can also safely say, Chair, the issues of the CCTV, we do work through our Department of E-Government. We have given them tasking letters, we've identified the funding, but we must also allow them to follow their own process to make sure that the appropriate service providers are appointed. They often work through the State Information Technology Agency. We also acknowledge through our own assessment that there are delays in that process. And we have now institutionalized an engagement with the department on a weekly basis so that we can fast track the work in that particular areas. Let me allow the CFO Chair first. If you will allow, I will allow the DDG infrastructure, and we can then, Mr. Ngwepe, you can conclude on some of the outstanding matters, and we can then hand back to MEC and the Chair. Chair, if you'll allow, we can start with the CFO. Thank you, Chair.
The CFO may proceed.
Good morning, Honorable Chair. Good morning to members, and good morning to MEC and colleagues and HOD. I will just maybe at a high level, I think HOD has alluded to the, in fact, even the MEC has also spoke about the challenge of the accruals that we are facing as the department. In the main, as he indicated, that these are historical accruals, as the evidence that we have that most of the controls were not implemented effectively in the prior year, and some of the work was done without purchase orders being issued, and you find that there's an increase of commitments. But what we have then done is to make sure that we do a proper reconciliation dating back from where the accruals were recorded. Some were recorded from 2012 and so forth. And we have then done a proper reconciliation, which we are still continuing, because some of the items were not on the system, as in when we are meeting the service providers, they will then provide us with the evidence. So in the main, we have then put a plan to make sure that we prevent these accruals going forward. What we have then been assisted by the Provincial Treasury is to implement in the system what you will call the budget blocking facility, meaning that once you have exceeded your budget in a specific line item, you can't raise a purchase order. So the system will automatically block you from increasing or capturing a commitment. So this will then assist the department in maintaining and containing the commitment so that we don't overcommit the budget that we have. So that is just one control. And then the second issue is that we have then embarked on a process of making sure that we then pay the accruals that we have accumulated so that they don't affect the budget of the next financial year. Just perhaps maybe as a reflective is that in the close of the financial year 24-25 financial year, we had accruals of the value of about 8 billion. In that 8 billion, it means that in the 25-26 financial year, it would have our budget would have then been reduced by 8 billion because we must settle those accruals. So we have then managed to pay about 4 billion of that, of those accruals dating back from that 8 billion. In this current financial year, we are then concluding to make sure that the balance that was then left of about 4 billion, we are then eliminating and paying that. Our plan is that come the end of August, we should then have settled all the accruals, which is that 4 billion. So that come the third quarter, we know that we no longer worried about historical accruals. What we are then concentrating is to make sure that we pay the current services going forward, and we effectively implement the controls that we've introduced, not to overcommit the budget. So that is what we are really planning to do that. In the second issue, it will also assist us in really focusing on making sure that we pay the service providers within 30 days as regulated by the PFMA. We've started to increase in terms of the percentage of service providers paid within 30 days. In the last financial year, at least we're sitting at about 66%. And in this new financial year, we think that come the third quarter, we'll definitely be registering the 100% payment of service providers once we conclude the accruals. Because in the main, as and when we're paying the service providers, we also, the current services, we're also paying the accruals. It then affects your 30 days because most of these invoices will be historic invoices. So there's an issue again regarding the procurement of beds and linen as well as mattresses. I can indicate, Chair, that we have been allocated additional funding by the National Department of Health to really focus on buying linen and bed as well as mattresses. So that funding was allocated from the beginning of the last financial year and is also continuing in the current financial year. In the previous financial year, we've procured about 845 beds. That includes mattresses. And we've also procured about 141,000 pieces of linen in the previous financial year. So in the current financial year, we'll also continue. We've been allocated about 100 million just to concentrate on ensuring that we procure those items of beds, linen, including the mattresses. In the current financial year, we'll also starting with the issuing of the purchase orders in the current month. So that we don't also accumulate accruals. Our plan is that once we've issued the purchase order, service providers should have completed to deliver by the end of the third quarter, and so that we then pay and settle the service providers. Moving in the fourth quarter, we don't have outstanding invoices. So that's the plan that we are planning. And thank you very much. And actually.
Through you, Chair. Good morning once again to the honorable members, the MEC and the HOD. As indicated, my name is Tolisane Kalada. I'm the DDG responsible for infrastructure. And I think HOD has covered me in most of the questions that would have posed. But there was one question by Honorable Adrianse around the feasibility on the solars. So maybe to share with the committee is that in the past 2 financial years, there has been institutions that the rollout of the solars has been done. I think we have completed around 32 of them. That would include your clinics and some of the hospitals like Kopanong and so forth. And there is a second phase in terms of the rollout. So the feasibility we're talking about would refer to institutions that would be participating in the second phase of that. But even before you start doing the work, you need to know what sort of solar intervention you will put in place. And hence, where they included this as part of our response. I thought that was important so that we give clarity in terms of that. Honorable Finis, in terms of the 2 million, maybe let's clarify this. The Tambo Memorial, because it relates to the Tambo Memorial Hospital, has got an allocation budget of 20 million for maintenance in the current financial year. But however, as it is the case for all the institutions, is that 10% of that in this instance is 2 million. It is within the delegation of the institution, meaning the CEO, to do what we call day-to-day maintenance. For an example, if you need to buy a globe, need to buy a door handle, a tap, and so forth, they can tap into that, assisted, of course, by the technicians that are on site to be able to do that. So, to answer your question, the 2 million is not for all the facilities. The 2 million is just 10% of the allocation of Tambo Memorial. When it comes to all the facilities around maintenance, our total allocation in the current financial year for all over 537 facilities we have in Gauteng, that would include your 37 hospitals, CHCs, your emergency service bases, your forensic pathology, your colleges, nurses colleges that we have. All of that add up to over 537 facilities that we have in Gauteng. We have a total allocation of around 1.1 billion. So I thought that was important that we clarify. In terms of the Raima Musa Phase 1 project, that project is a project that will take us 18 months. As we have indicated in the presentation, we have appointed DBSA as our implementing agent, and through the plan that they've shared with us, the implementation plan is that the appointment of the contractor will be finalized by end of August, beginning of September. So then the 18 months will then kick in from that time. And so that is only the Phase 1 that deals really with all those infrastructure issues that would have been packaged under that. In terms of the starting date for the term contractors, so what we have done in most of our institutions, including Chris Anebara, is that because we have experienced that sometimes disruption or emergencies happen at night, 2 o'clock, 1 o'clock in the evening, we then need to have people 24/7 that are stationed at the facilities. And that's what we mean by this term contractor. They are there for 12 months. What we've did in the previous financial year, starting from April, we appointed them for 12 months. And they've extended in the current financial year up until we finalize the panel of contractors that we're in the process of evaluating. And also I must state that we have technicians in all our facilities that are on-site artisans that are there, that are part of the team from our sister department, which is the Gauteng Department of Infrastructure, that are assisting us where possible with our day-to-day maintenance and then some of the things that they would attend to. But the challenge is that at night, they are not there because they would have worked from 8, maybe to 4:30 and so forth. And therefore we needed, a mitigation plan to say beyond that, what do we do in case there's a breakdown in HVAC and all of that. So that's why we have these term contractors. I think in terms of the timelines for the equipment, I think that was David in CHC. Of course, we've indicated is the plan for us to check. If it's just for me to go and check the exact timelines in terms of when, because what we do, you place the orders and then you will only be able to pay the supply once the equipment have been delivered. So that information, I don't have it with me now in front of me, but it's something that we're pushing to make sure that is done as a matter of agency. I think the HOD has explained the rationale behind the issues around prioritizations of budget. I think honorable members would know that a budgeting process is a thorough engagement, a consultative process that precede the final announcement of the budget, wherein as a department would have engaged with the Gauteng Provincial Treasury and the National Department of Health. And maybe safe to say that for our infrastructure portfolio, there are only 2 funding sources currently. You have the equitable share, which is money that is allocated to the province and therefore allocated to different departments and all of that. And then we have the grant from the national. So during the budget process, you then have to identify, funding from within. We've got quite a lot of capital projects that are active as we speak. And therefore, throughout that process, the plan was to say the resources must then be redirected to complete, so that you don't have infrastructure projects that are incomplete throughout. You complete those projects and then come and reintroduce the ones that you have not started, where you have just completed planning later on. And hence, there were all of these gives and take, which has been a process. And I must indicate that when it comes to the Raima Musa phase 1, it's a project that we would have wanted to commence in the previous financial year. But because of the budget cuts that were effected in the previous financial year, the project had to be deferred in the current financial, which we can confirm that the budgets have been confirmed, and hence it was possible for us to appoint DBSA as an implementing agent, and therefore to be able to appoint contractors. I think HOD, the rest, as I've indicated, we have covered. Let me leave it there. Thanks, honorable members, MEC and the HOD.
Thank you so much. Just as the last questions, I think the other one was with regard to, and especially from Honorable Sibande, regarding the vacancies and stability in institutions. And why did it take so long? Why is it taking so long? Just to state, honorable members, that the CEO positions, because they were advertised on a short-term, contract. It was not; they were not really attractive to individuals, especially those within the clinical setting, moving from a permanent position, and then now you go into a 5-year contract a position. And hence we went on to this drive to convert them, of course, with the concurrence from the DPSA as well, to convert them to become permanent, position, just to ensure that they attract a larger pool of, candidates that will be able to, occupy, those particular positions for long-term stability of our institutions. So those adverts were made on Sunday, this just past Sunday, through Sunday Times, so that the larger audience can be attracted in as much as those positions are concerned. So we're really hoping to fill them, as soon as possible. So in the second quarter of the current financial year, we can have a bit of stability within the institutions in terms of management. The last question is with regards to the manual and paper files that are existing in our health facilities. Of course, this process is that we embarked on is twofold. So, the first approach is that we have got those old files that are in the institutions already for patients that have already came to seek, healthcare services. So we have now embarked on what we call e-digitization, which is basically a process where we convert a hard paper record to become an electronic, paper version. This is just so that, this file can be, securely stored, on a cloud server, protected, and is easily accessible. And just to actually start, doing away with the paper records. And of course, the second fold is when we're talking about now the new visits that are coming into the institution, that are the new files that needs to be opened. And for that one, we are actually, implementing through the National Board of Health, what you call the electronic medical record in our clinics. So that is going to be now a patient file electronically on the system for the new patients that are coming into the particular, system. And all in all, this particular process that are there is just to do away with the paper records, and just to ensure that the issues of storage of the files, the issues of files being lost, they can be taken care of in as much as that is concerned. Back to you, Chair. Thank you so much.
Thank you very much, Honorable MEC. Any closing remarks from your side?
Chairperson, before MEC come on platform, can I comment something?
Yes, you may, Honorable Sibande.
Chairperson, I don't know. I think we need an assistant from the office, from the MEC itself. the issue of medication which I'm speaking about. And instead of the department respond about what we raised, they respond about the procedure. That if medication doesn't get it in the province, we know. But who's supposed to make a requisition? That is my key fundamental question. Because on the side of the national, they are not fortune tellers. It's like the province itself is not fortune tellers. The clinics must make a recommendation, they must make a request that they're running short of this and this and this and this. You see, because the issue of Schedule 5 and 6, I mean, those medication we know that are very, very sensitive and they need to be locked or whatever. I'm trying to highlight that, you see, I think we're supposed to be taken very serious because when we are doing our oversight, we don't do oversight with infrastructure and vacancies alone. No, we also check inside. And they mustn't forget that from the department side, that some of the information we get it directly from the those doctors which are responsible with the pharmaceutical inside the hospitals, that they don't have this and this and this. That's why comes the question that for how long does it take and for them to get those particular medication? I've forgotten the name. Uh, uh, there is that medication which is necessary in some of it is necessary in some of the clinics in terms of where the people are over, I mean, in overpopulated constituencies. Because in case of the car incident, accidents and the like, this medication, it also controls maybe the pains to the victims in that particular car accident and the like. And, you know, I'm becoming worried if they take us like that, if you tell us about the procedure instead of telling us about how and when are you going to address that particular issues which we are raising. To MEC, I'm saying, MEC, make a follow up to those people who are responsible, supposed to make an oversight in terms of those things, because all of us, we are accounting officers. In terms of the FMA, we are also, as members of parliament, accounting officers, as they are accounting officers. They must account properly, not to tell us about the procedure. Thank you very much, Chairperson.
Thank you very much, Honorable Sibande, for that input. Honorable MEC, over to you so that I can close.
No, thank you very much, Chairperson. We appreciate all the comments and the chastisement that is being done by members on us. We take it in good spirit. We shall improve on what members have recommended that we must do, and maybe give us another 6 months to give a progress report, Chairperson. Thank you very much to yourself and to the honorable members. Baie dankie.
Baie dankie, Honorable MEC. Mine is just in terms of the outstanding, especially the timelines, with the dates of the contract appointments and completion dates of the projects. We want to request the department to submit this information in 7 days, Honorable MEC. And we will see to it that we have that monitoring tool to monitor the progress of the department in terms of the recommendations that the committee have made. So thank you very much for your responses, Honorable MEC and the team. And we will surely engage with the department on the other issues concerning the province. So thank you very much, Honorable MEC and the team. You are released.
Thank you very
Thank you
much
very
and
much,
goodbye.
Chair.
Okay.
Marcia, can you flight the agenda? Honorable members, we have received the agenda. Can I get the mover for the adoption of the agenda? Honorable Fanny.
Yes, I'm moving for the adoption of the agenda, of the minutes.
Thank you very much. Thank you very much, Honorable Fanny. Yes, for the minutes. Sorry for that one. So, honorable members, can I get a second, Honorable Sibande?
Thank you, Chairperson. And the members, I would like to support the adoption of the minutes.
Thank you very much, Honorable Sibande. So the minutes is duly adopted. Honorable members, I just want to, we are now on the point of any other business. I want to request our support staff if they can establish a matrix in terms of the recommendations for each and every oversight visit that we have, the recommendations that we as the committee have made, and to see to it that it is updated before each and every meeting that we have with the different provincial departments. And besides from that one, in terms of the responses, when we have asked questions in the meetings, especially the written responses, to establish a metric for that one as well, so that we can monitor the progress of the different departments as well as the national departments, not just health, it's also social development and each and every entity of the different departments. Can I request the honorable members if you can make a official proposal in terms of that? Honorable Adriaanse.
Honorable Chairperson, I would like to support you absolutely in that proposal of yours, because that will assist us greatly if we can keep track on the reports we receive, because in many cases we are bamboozled with other information, and then we have to recall everything we did. And in this case, this morning, what we got back and what we saw and the report we received didn't correlate. So if we can have a track and all everything that we recommended, the filing system was the only thing that I can remember that was really done something to. So I support you fully in this on your proposal. Thank you.
Thank you very much, Honorable Adriaanse. Honorable members, there was a mover for that proposal. Can I get a seconder in terms of that one?
Second, Chair.
Thank you,
Honorable
Honorable
Mokwe.
Makwele. Thank you, Honorable Makwele, for seconding that proposal. So, honorable members, thank you very much for availing yourself for this meeting. And I want to thank the support staff for all your hard work. We as the committee really appreciate it. So thank you very much, honorable members. To the support staff, this meeting stands adjourned.
Thank you, Chairperson. Have a blessed day.
All of you too, Honorable Adriaanse.
Lekker dagie mee, Bokkie.
Lekker dag vir u ook, Honorable Sibande.